My name is Dr. Okuku. I'm a Consultant Medical Oncologist at the Cancer Institute. This month of November, we are coming to you from the Cancer Institute to alert you about a challenge that we have in our country of prostate cancer patients increasing every other day. The prostate is a small organ that is hidden beneath your urinary bladder. You cannot touch it individually, but it has multiple effects. It's responsible for many functions in the body. It's a very similar position to the uterus in a female. Men cannot function to give birth to children if they do not have a prostate. So it's required, it has a role in reproduction. It also does help us when we're passing urine and other functions. When the prostate has issues, the symptoms are... My name is Dr. Okuku. I'm a Consultant Medical Oncologist at the Cancer Institute. This month of November, we are coming to you from the Cancer Institute to alert you about a challenge that we have in our country of prostate cancer patients increasing every other day. The prostate is a small organ that is hidden beneath your urinary bladder. You cannot touch it individually, but it has multiple effects. It's responsible for many functions in the body. It's a very similar position to the uterus in a female. Men cannot function to give birth to children if they do not have a prostate. So it's required, it has a role in reproduction. It also does help us when we're passing urine and other functions. When the prostate has issues, the symptoms are mainly associated with passing urine or micturition. They range from difficulty passing urine frequently, what we call frequency, waking up at night to pass urine many times. They also range from blockage of urinating or poor stream for that matter. When a man goes to pass urine, he finds the stream, the flow of urine is reduced or it completely shuts down. And so these symptoms do affect men, and in Uganda, in the villages, we do have men who have buckets besides their bed. Most old men in the village do have buckets. And he does not wake up to go out of the house because he needs to pass urine frequently. So he has a bucket to ease his ability to pass urine in the night. And so these are some of the symptoms among many. There are also symptoms that will be noticed in the patient when the disease has advanced. Some of those include backache, blood in urine, poor sexual function, loss of weight, poor appetite, and so on and so forth. In the past year and in this year, we will receive more than 1,000 patients here in Mulago with confirmed prostate cancer. In other cities or towns of the country, we will have probably another 1,000. And there will be many who do not even access these hospitals, so we do not know the exact number. But we so far receiving almost 2,000 men every year. Many of the men who come very late. The disease is advanced. The reason we believe is lack of information. And today and in this month of November, we want to make sure that you, wherever you are, take time, if you're above 40, to go and have a check to establish the status of your prostate, because prostate cancer is so common among African men and also Ugandan men, and it's also one of the commonest cancers worldwide. It can be cured when found early. Unfortunately, when it's late, it's a difficult journey. Difficult journey for the patient, difficult journey for the family. So we would want you to come to the Cancer Institute and have a check. We do a few tests when you come to establish the status of your prostate. But we encourage men who have the symptoms that I have mentioned. But let me repeat those symptoms now. Number one, if you have frequency, first of all, if you're above 40 years and you have the symptoms, you have frequency, you're passing urine all the time. Whenever you take a little amount of fluid, you have to rush. If you have urgency, this means that when it's time to pass urine, you have to run quickly. Otherwise, the urine will come before you reach the toilet. That is called urgency. If you have nocturia, you pass urine many times in the night. If you have poor stream, when you go to pass urine, the urine dribbles or comes at a reduced amount, we are interested in reviewing you. Should you also see these other symptoms, you see blood, you have pain on passing urine, and in some cases, your sexual function may reduce. That can also be a symptom of late prostate cancer. Other symptoms for late or advanced cancer of the prostate include pain in the bones, swollen limbs, wasting, poor appetite, and so on and so forth. So we want to encourage all the men who are listening to come and have a check at the Cancer Institute. The link with that, however, that behavior may predispose you to other sexually transmitted diseases, but also other cancers, including anal cancers and Kaposi sarcoma. So there are other risks associated with that, not necessarily prostate cancer. However, you can also reduce the risk of prostate cancer to some level. But we know that number one risk factor is age. Once your age is about between 60 and 70 in Uganda, that's when we diagnose most men. But we believe the cancer may start within the age of 40 or 50. So age is one risk. The other is being a man, of course, but the other is family history of prostate cancer. The more people you have in your family who have diagnosis of prostate cancer, the more your risk increases. So those are the few risks. Of course, it's good to keep a healthy weight and to eat healthy, do regular exercises, eat more a plant-based diet, and avoid processed foods as much as you can to try to cut your risk of not only prostate cancer, but other non-communicable diseases.